So as we know, lung cancer is one of the leading causes of death in adults, and the leading cause of death amongst females over breast cancer in terms of mortality. Mortality remains high because the majority of times when we identify these patients, even when surgery is carried out, their recurrence rate remains high, and mortality is, despite diagnosis and treatment, remains quite high. So early detection is important. One thing, a take-home message is that if you have certain risk factors, such as being a previous smoker beyond a certain age, and you have the opportunity to get early screening for lung cancer, getting a low-dose CT chest, you may actually be able to get early diagnosis made at the time that resection can be result in cure. The other thing is that there has been an advent of new therapeutic agents that are targeting receptors in the surface of the cancer cells via immunotherapy, that when the proper profile is demonstrated, you can target some of these tumors in a much more efficacious way than years before. So we can impact natural history of the illness. We can prolong survival significantly. In some cases, years beyond the initial survival. So there has been a definite improvement in the opportunity to treat certain lung cancers, and I'm talking non-small cell. So the big improvement has basically happened with the opportunity to treat non-small cell lung cancer. Clearly there's a room for surgery, and we're looking at basically a comprehensive approach of the treatment of lung cancer, including the early diagnosis, prevention, diagnosis, and treatment in a multidisciplinary. And I want to emphasize the word multidisciplinary. It truly is a multidisciplinary approach.